Hi Richard, it's Dr. Buford. We're just getting started on the right shoulder. We're looking at from the back to the front. Everything you see is magnified 30 or 40 times, just like before. Your biceps we had already worked on before, so that's no longer inside the joint. You can see a little bit of arthritic change in the glenoid, especially up here at the top. As we rotate and look down, you can see that superior border of the glenoid is a little bit degenerative, where the cartilage is thinned out a little bit. Up here. This is where the rotator cuff is formed. And you see a big hole in the tendon. We're going to get a better look at that once you change positions with your shoulder. I just want to make sure there's nothing else to worry about inside the joint. And again, at this point, the most remarkable thing is the arthritis. Towards the bottom and the back of the shoulder, we can see there's a little bit of fraying in the labrum and definitely some redness in the capsule, but no other significant loose pieces or flaps of cartilage or tissue to worry about. So I think we'll stop here and get to work within the subacromial space, working on this rotator cuff tear. Okay, so we're looking at this large tear in the rotator cuff. Okay. Posterior is way back here. You can see an old anchor there. And anterior is way up there to the left. There's our cannula up on top of the cuff. So we're going to try and use some more tricks here to get this to heal. We'll take the spinal needle. We'll plan placing our first anchor here. Get an anchor in about like that. That'll give us a pretty far posterior anchor. Okay, here's our first anchor in the bone. You can see how far posterior it is. This is kind of the midpoint of the humeral head. That's anterior. And this is way at the back. That's infraspinatus tendon back here. Okay, so we're going to go ahead and start to manipulate some of these sutures and see about passing these through the tendon. Take this black and white suture out first. Underneath, you want to make sure that if there's any deep layers of this tendon that we get them. That's pretty much it. Back here with this stitch. Let's see where that's coming through. So we've got the first stitch passed. You can see here, when we tie this and tighten it, it's going to have this effect. It's going to push the tendon down just like that. So right now it's going to buckle in the breeze there, but it's going to snug it down like that. I'm going to do something I usually do not do. I'm going to pass another stitch even more posterior than that black and white one. I'll show you how we do that in a minute. Okay, so we've tied the solid blue suture. We're now tying the black and white one. I'm just trying to make sure that we have a solid posterior anchor that's holding down this infraspinatus part of the tear. And then we're going to slowly advance anteriorly to repair the rest of the infraspinatus and supraspinatus. So we'll let the video run for a minute and give you a good picture here. Okay, so we are done with the first 2/3 of the stitches from the first ankle. We'll hold those blue and white because we haven't tied them yet. And we're just going to clean up a little bit here and make sure there's nothing else we want to do posteriorly. So it'll get hard to do that in a minute. Right now we're just shaving some of the bursal tissue. Okay. And now as we look down, we can see we've got 2 sutures tied. Here's what's left of the hole. So we still, even at this point, we're still, if we were just starting now, this would still be a very large tear. So we've already repaired the posterior part of it. Okay, and so those two look solid. We've still got this blue and white suture to tie. We've got to pass it first, and so we'll get to work on doing that. Just pulling that blue and white suture underneath. There it is, coming out there. I need to go out. Okay, so we've got the first 3 sutures passed. There's 1, solid blue, black and white, blue and white. So those are 3 passed from the first anchor. We've now got this hole to deal with. See that? So probably 2 more suture anchors to place. We'll take our spine level. I'm not sure if I can use the same hole. We'll have a look here. Now I think I need to move over a little bit. So yeah, that's looking like a better spot in terms of our anchor placement. And then you've got room for probably 1 more over there. Possible. Okay, so we've got a second anchor down. You can see the first one there. Here's the second anchor. Here's the torn edge of the cuff. So we're going to go ahead and reach in and take out this blue and white suture. And now we're ready to make some more passes here. Here's our suture hook. We're going to place a stitch. You can see the next one's to go right about here. Your spacing is a little bit closer together to get even a stronger repair. Like that, but that's where it needs to go. And then we're going to place the stitch right about here. Okay, so here we are pulling that stitch back. We're going to reach in, first we're going to pull it all the way through. That's good. And now we're going to reach in and get the partner suture here. A little bit of crochet work, something like that. And now we're going to tie that knot. Okay, so here we are getting ready to pass the next stitch in line. There's where we've been. This is where we're going over here. We're going to pull back. Tanya obviously be very gentle on the cuff. Stitch coming through, we're going to reach in and get the partner black and white suture. And now we'll tie that up. We've got 2 of the 3 sutures from the second anchor passed and tight. You can see out to the left things are looking good. To the right we've still got this big hole. But now we're going to pass the next one here. So we're going to go right about here with this hook. Okay, so we've got 6 stitches tied already. And we've still got this gap to try and close up. The good news is that the tendon still has some length to it. You can see the articular surface is back up underneath there. So we're able to cover the bit more of the footprint. We're going to place our next anchor right about here. Okay, so we've got the next anchor down. This is the 3rd one. We're going to place our crochet hook and start passing sutures around just like we've shown you before. We'll take the solid rule and pull it out. Okay, so now we're ready to pass another stitch. It looks like we can still use our, what we call our turn to the right suture hook here. We'll get this organized and show you some more in a minute. We tied the next stitch, and now we're going to work on the blue and white ones. This is from the 3rd anchor, just to remind you. We're about to tie or pass our 7th suture, 8th suture, I'm sorry. So we've got the 2nd blue and white suture tied. We've still got, that's our gap that's left here. We're going to go off on the video for just a minute, clean up the edges. We've got that 3rd, looks like final stitch tie. So this is all the way anterior. And the final one was that black and white one that you see there. So we've got the black and white, blue and white, solid blue, black and white, blue and white, black and white, solid blue. So we've got 9 stitches holding this down. As I rotate your shoulder, you can see how that's all connected now. You can see the muscle back in the distance. Let me focus that a little bit better. Okay, so now the final step here, we're going to try and harness a little bit of biologic healing also by making some little holes in the bone. So we're going to start way over here and just tap down. Okay, this is just going into the marrow. We'll make another one over here somewhere, right about there. Okay. Make another one about here. Good, so we're going to put in the shaver next. And just want to make sure that we've got everything done that we want to. Just like this one. There you can see the footprint. It's exposed. And the last thing I want to show you is as we turn down the pump pressure, you'll start to see some of those little holes in the tuberosity start to leak out some of the bone marrow, and hopefully some of the healing factors and stem cells and growth factors and cytokines. So there you can see how that comes out and starts to cover up where we did the surgery. Okay. So we're going to finish up here and get you back to the recovery room. Good luck to you now. Bye-bye.